Yeah, Hantavirus is not the same as COVID-19. That's what we're hearing from local, state, federal, even international health agencies. But the question is why and how really are they able to tell us that given the limited data of this particular strain? I went to an infectious disease doctor at Johns Hopkins for answers.
We're relying on the outbreak evaluations from the past. And like we've said, there haven't been hundreds of them, which is good news. But that also means that we have limited data to use to be able to fully know how it spreads.
Johns Hopkins infectious disease doctor Geeta Sood referring to the spread of hantavirus, particularly the Andes strain, the same strain that infected several people aboard the MV Hondius cruise ship. She says though experts are still learning about this strain, she's confident close contact is a necessity in order to spread it.
It's not a new virus. It's something that we've experienced and seen and known about for decades. We have seen in these outbreaks that household contacts do get infected, but not 100%.
It's why she and other health agencies like the Maryland Department of Health and the World Health Organization are saying the risk is low.
All of the data that we do have is quite reassuring that it really has to be close contact.
Adding in, she's anticipating more cases over the next couple of weeks.
But that by itself isn't concerning. If we start seeing secondary spread, if we start seeing people who were exposed outside of the cruise ship or who were not exposed to the cruise ship, at that point that would be concerning. But I'm not expecting that to happen.
And we know the World Health Organization also has said that they are expecting to see more cases, but they did add that there is nothing to fear. They say the risk is low. This is not another COVID. Their words. In North Baltimore tonight, Tori Yorgi, WBAL-TV 11 News.
Tori, thank you. And we invite you to see the history of hantavirus across the United States. We have an interactive map that goes state by state showing the number of cases in a 30-year period from 1993 to 2023. It's in the WBAL-TV 11 News app.